Karthik, you are taking me, long back in the flashback. I was in Shimla. My father was a Himachal government employee, and you are making me, of course, nostalgic because my journey in the field of dentistry started in 1981. In 12th, I was number 2 in Himachal Pradesh. And Himachal government allotted me a seat in King George's Medical College, Lucknow.
रैंक्स कितने इम्पोर्टेंट है और रैंक्स के साथ कितनी डेप्थ होनी चाहिए लर्निंग्स में?
Excellent question, Dr. Karthik, because people really run after ranks, which has absolutely no meaning once you are on your own in the field. I can firmly say that rank really does not matter. It is the skills, it is the values, the seriousness, that is what matters.
You have been a teacher since very long and हम तो जब भी आपके पास आते हैं बड़े ही प्यार से आप बात करते हैं. तो हाउ टू मेंटेन दैट स्ट्रेस फ्री एनवायरनमेंट इन योर डिपार्टमेंट? बच्चा है, उसको सिखाना भी है, डांटना भी है, लेकिन एक स्ट्रेस फ्री एनवायरनमेंट में, ताकि उसकी प्रोडक्टिविटी और क्रिएटिविटी ज़्यादा से ज़्यादा बाहर आ सके.
Dr. Karthik, again a very interesting question, I would say. स्टूडेंट को अपग्रेड करने से पहले इस सिचुएशन में व्हाट आई फील इज दैट अ टीचर नीड्स टू अपग्रेड हिमसेल्फ. We need to understand that world has changed, and so has our students. Now the stresses are far higher. There's more hurry, there is more worry, and probably there is more curry also as far as our students are concerned. But as a teacher, you need to deal it with gently. You need to understand, you have to go down to their level to understand their pulls and pressures, and obviously you need to help them, guide them, soothe them in a way that their stress levels are reduced, and they will always be happy when you treat them like that. They will be yours forever.
It's all about teeth. Presenting to you India's most famous dentist with Dr. Karthik D'Nojaa, powered by Karthiktva.
नमस्ते सर, वेलकम टू द शो.
Namaste, Dr. Karthik. My pleasure to be here.
ये बात है सर कि आपके साथ जब भी बात करते हैं तो एक डर नहीं रहता. शायद आपकी आंखों में वो प्यार दिखता है बच्चों के लिए, जो सर आप हमेशा से ही इतनी प्यारी बातें करते हैं. तो आज उसी पे ही बात करते हैं सर.
क्यों नहीं डॉक्टर कार्तिक?
लेकिन उसके पहले हम ये आपकी पर्सनालिटी कैसे डेवलप हुई और आपकी डेंटिस्ट्री में कैसे जर्नी शुरू हुई, उसके बारे में कुछ बात करेंगे.
डॉक्टर कार्तिक, यू आर टेकिंग मी long back in the flashback.
Nostalgic.
And you are making me, of course, nostalgic because my journey in the field of dentistry started in 1981. I was in Shimla, which is the capital of Himachal Pradesh at that time. My father was a Himachal government employee. I finished my 12th in 1981. And like any youngster of those times, my parents also wanted me to go to either engineering or medicine. And to tell you the truth, I didn't know that a field like dentistry existed
Okay.
at that time.
Hmm.
For me, it was only MBBS or going to acquire an engineering degree was the other option.
Right, sir.
Just by sheer luck, one of the colleagues of my father told him that since Himachal Pradesh has no dental college, government of Himachal Pradesh has been allotted some seats by the central government for which the state government runs a test, and then if you qualify the test along with the percentage of your 12th marks, some percentage of your 12th marks, you are granted that seat. So it was in fact my father who gave me the information that such and such course also exists, and you should try for that, because in 12th I was number 2 in Himachal Pradesh as far as my merit was concerned. So I opted for the test, and as luck would have it, I qualified, and Himachal government allotted me a seat in King George's Medical College, Lucknow.
Okay.
And I was told to report to the college. So here I was finishing my 12th, getting my result of 12th class in July 81, and going to KGMC Lucknow in August 1981 to start my BDS course there. So this was how I joined dentistry.
Right. Right, so. And then you joined Perio, of course.
Yes. So life after Shimla, which was a small town, is still a small town, was very, very different. So coming from a very small place where everybody walks, people don't have vehicles, and we had a very childhood which was sort of very protected that way, because there was no city culture, big city culture existed there. So here I was, from Shimla to Lucknow within a span of 1 to 2 months, and
Right.
I really took some time to adjust in Lucknow, but KGMC was a dream college, I would say, because by that time I had researched enough about the dentistry and the heritage of KGMC, and I was really, very, very proud of having gotten a seat in KGMC. So started my course in 1981 and finished my BDS in 1985. So
Okay.
it was a 4-year program. I was very good in studies. I was a university topper. I scored well in practically every subject, and by the end of it, I was assured of a MDS seat in the same college. So I finished my 6 months of house job, because we were having only 6 months house job at that time. So by the time I finished my house job, I got a seat in KGMC in the discipline of periodontics, which I joined in 1986. And again, it was a wonderful journey of 2 years, because in our times, MDS was 2 years. So I did my MDS under Professor K.K. Kapoor and Professor K.K. Mehrotra. They were very well-known names in the field of periodontology of those times. So having done post-graduation under them was really a privilege. And by the time I finished in 2 years, that is 1988, end of 1988, I was ready to conquer the world, as the saying goes.
Right, right. So what was the journey after doing masters in periodontics?
Well, Dr. Karthik, by the time I had finished my MDS, I had already got a job in Himachal government, a government job, which, considering the times were such that there were not enough qualified dental surgeons, what to talk of postgraduate dental surgeons, the government was very keen that I should be appointed uh, in a good job in Himachal government, and the government was sort of ready with an offer. But having explored, KGMC, and having broadened my horizons during these 7 to 8 years which I spent in Lucknow, made me realize that I am not cut out for a regular government job.
Okay.
And I need to, fly higher.
Right.
So I got testimonials from my professors. Again, I did very well in my masters. I was awarded a gold medal, and they, sort of encouraged me to go and try my luck out in a metro city like maybe Delhi. So there I was, moving out of Lucknow, bag and baggage, and straight not to Himachal Pradesh but to Delhi. And after a little while, I got a job of a senior resident or a registrar in one of the premier hospitals of Delhi, which is Dr. Ramanor Lohia Hospital, also called Willingdon Hospital. And I joined in Willingdon Hospital as a registrar. That was the year 1989. So again, that hospital job gave me a lot of exposure because, to tell you the truth, the entire hospital, ran only on the shoulders of residents.
Okay.
And here in the Department of Dentistry, I was the only senior resident, and besides attending almost 100 patients, OPD in the morning hours, I was doing emergency duties at night also, because a lot of trauma cases with medical legal complications were turning out at the emergency, and the hospital was in a very busy part of Delhi. So practically 24 into 7 I was, there attending to the patients, either in the OPD or in the emergency. But that 3.5 year exposure actually, polished me to such an extent that besides my perio, I was doing as good a job as an oral surgeon does, because I was handling a lot of trauma cases and we were managing them both in local anesthesia as well as general anesthesia. So after finishing my tenure as a registrar, my head of the department, Dr. Sabarwal, in Ramanur Lohia Hospital, offered me a pool officer's job, which is a job under the Ministry of Science and Technology. And again, it was a tenure job of 3 years. And sir told me that you carry on in this hospital, and we'll see you get adjusted, as a permanent employee here. So I took his advice. I was there. I did my pool job for 1 more year, and then 1994. By that time, I had married also. I thought that I should now venture out of the hospital. Okay. And once again, I sort of said no to a government job and went in private practice. So I took a place on rent in a commercial complex in Delhi, and started doing my dentistry there. Also, at that time, dental colleges had started, mushrooming in North India, and lots of private dental colleges were coming up, which were offering, good salary to the doctors who were joining. And at some point of time, I thought that I have been very good in academics. So if I get a chance to now, upgrade my skills as an academician, I should join a dental college in whatever capacity or whatever role they offer me. And thus started the journey of private dental colleges from 1998 onwards, which has continued till today.
तो सर रैंक्स कितने इम्पोर्टेंट है और रैंक्स के साथ लर्निंग्स कितनी इम्पोर्टेंट या कितनी डेप्थ होनी चाहिए लर्निंग्स में?
Excellent question, Dr. Karthik, because people really run after ranks, which has absolutely no meaning once you are on your own in the field. Being a private practitioner of almost, more than 30 years, and having done, jobs both in the government as well as private sectors, teaching as well as clinical jobs, I can firmly say that rank really does not matter. It is the skills, it is the values which you inculcate during your studentship, the seriousness with which you have learned your craft. That is what matters in the end, once you are out there in the big bad pond where there are a lot of crocodiles.
Right. So
When you are a student of such great teachers, some of their greatness rubs upon you. And I'm telling you that you actually feel those blessings within you when you yourself become a teacher and you have postgraduates or undergraduates or PhD scholars working under you, because you remember those times that how your teacher would have reacted to a certain situation, and you try and handle the situation the same way. And our teachers, they were very strict, very, very strict, because the era of those teachers were like that only. They were workaholics, and very, very strict, and this was what was expected out of us. So during my stint as a teacher, yes, I have been strict taskmaster, but I have remained polite, I have remained grounded, I have been friendly, but firm also with my students, so that those who have come to learn, should learn the best I have to offer. Otherwise, I would be cheating my own, self-conscience if I am not true to my task. So I have always tried, that my students should do better than what I have done in my life. And by and large, I think I've been successful. I have trained, any number of postgraduates, any number of PhDs, and any number of undergraduate students who still are very well connected, and I really feel very, very happy whenever I learn about their achievements. And they were the ones who I motivated them to write research papers. And I'm telling you a truth that the first research paper ever which I wrote was in 2008. With a couple of my students. And soon that one research paper has now gone into more than 160 research papers during the last 12 years, all thanks to my student.
बहुत से ऐसे स्टूडेंट्स होंगे जो रिसेंटली ग्रेजुएट हुए होंगे, जिन्होंने अपना पोस्ट ग्रेजुएट पूरा किया होगा, एंड दे विल बी नाउ प्रैक्टिसिंग सून इन द फील्ड ऑफ डेंटिस्ट्री. जब तक टीचर्स का साथ होता है, सीनियर्स का साथ होता है, तब तक तो हम अच्छे से मैनेज कर पाते हैं. लेकिन जब प्रोफेशनल फील्ड की बात आती है, तब क्या बातें दिमाग में रखनी चाहिए?
See, to tell you the truth, Dr. Karthik, I have come from KGMC, and those were the days when we were taught by our seniors.
Okay.
especially the seniors, that both your seniors and your teachers, they are either a royalty or one better, they are gods.
Okay.
And you are supposed to treat them like that only. Those were the times we were, made to realize that whatever you are going to achieve in your life would only be through either your seniors or through teachers, and you have to be obedient to them to the extent that whatever they say should be taken as a gospel truth. And your acts should be exactly like that only. So we had this 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 thing very clear in our mind right from our KGMC days, that to be a good student, you have to be most obedient and listen to what your teachers tell you. You can't really take them non-seriously, you can't really take them lightly, you can't really ignore their advices, and you can't really think that you should do your own way once you are in the hands of these people.
You have been a teacher since very long, and आपके पास बहुत से स्टूडेंट्स पढ़े हैं. हम तो जब भी आपके पास आते हैं बड़े ही प्यार से आप बात करते हैं. तो हाउ टू मेंटेन दैट स्ट्रेस फ्री एनवायरनमेंट इन योर डिपार्टमेंट, और वो एक सैनिटी होती है ना, वो टेम्परामेंट, वो सब कुछ कैसे है कि बच्चा है, ठीक है, उसको सिखाना भी है, डांटना भी है, लेकिन एक स्ट्रेस फ्री एनवायरनमेंट में, ताकि उसकी प्रोडक्टिविटी और क्रिएटिविटी वो ज़्यादा से ज़्यादा बाहर आ सके.
Dr. Karthik, again a very very interesting question, I would say. स्टूडेंट को अपग्रेड करने से पहले इस सिचुएशन में व्हाट आई फील इज दैट अ टीचर नीड्स टू अपग्रेड हिमसेल्फ. गॉन आर द डेज when I was a student, there were I would say, let me say that there were no distractions, there were no means social media, and there were very little of I would have, in 7 to 8 years of my stay in Lucknow, I think I have had phone calls with my parents only on 2 to 3 occasions. That was about all. Or we were conversing through letters and all. So that was the only communication with your patients, maybe with your near and dear ones. And otherwise, for us it was simply college, library, projects, and that's about all. Now we need to understand that world has changed since then. It's been 3-4 decades have passed, and world has changed 360 degrees, and so has our students, so has their commitments, so has their values, so has their the way they spend their time. So one needs to be in tune with the times, and having understood the situation that now the stresses are far higher than what they used to be in our times. There's more hurry, there is more worry, and probably there is more curry also, as far as our students are concerned. They are eating out, that
Yes,
is why
of
I
course.
said. So this deadly combination of hurry, worry, and curry actually puts a student under a lot of stress. Plus they are now so much connected with their near and dear ones through this device called mobile phone, that even if we try to tell them to focus more on the other things, they still remain a little distracted, and it is understandably so. But you, as a teacher, you need to deal it with gently, You need to understand, you have to go down to their level to understand their pulls and pressures, their, what their peers are doing to them. And obviously you need to, help them, guide them, soothe them in a way that their stress levels are reduced, and then they can produce their best, they can give their best, and they will always be happy. When you treat them like that, they will be yours forever.
Right, so
I tell you, this remains the only mantra. You have to get down at that level and then understand the situation. It can't be a situation where I remain sit on a high pedestal that I am a professor and the student is at a lower pedestal. No, we'll both have to be at the same level, understand, and then teacher has to act accordingly to obtain the best output.
Sir, as you rightly said, ki hurry, worry, and curry. So we have some sort of lifestyle where we study for like 7 to 8 hours, or we work and we'll be sitting for 7 to 8 hours. Or I would say least activity, physical activities are connected to our day-to-day routine. We are most of the time on the phone. Our moods will be decided by our phones or the shows we are watching, because in a way सब कुछ connected है. आप जो देख रहे हैं उससे क्या हॉर्मोन्स आपके बॉडी में रिलीज हो रहे हैं और वो क्या आपको अफेक्ट कर रहे हैं, यू नेवर नो. ऑफ कोर्स पेरियोडोंटल हेल्थ भी अफेक्ट होता है. स्ट्रेस, क्योंकि स्ट्रेस पड़ता है तो हैबिट्स बनती है.
Again, a very valid question which you have raised, Dr. Karthik, because जैसे आपने कहा कि periodontal health, being a periodontist, I can say that there's a sub-discipline in periodontology which we call as periodontal medicine, which is exploring all these links which you have stated, and the evidence has clearly shown us that there's a bidirectional relationship with most of these conditions which are systemic in nature, but which occurs because of some or the other periodontal disease. You have given a wonderful example of stress as to how the cortisol, is released in the body and how that actually aggravates the condition, and how it leads to other related conditions such as sleep disorders and so on and so forth. And very interestingly, I would tell you that in the year 2011-12 there was a very interesting editorial in Australian Dental Journal which was written by Dr. Mark Bartold, who's the editor of Australian Dental Journal. And at that point in time, in that editorial, he has stated that 44 systemic diseases or bodily diseases can be linked with your periodontal problems. And that included the diseases you said, plus other major organ systems such as the cardiovascular, such as the respiratory, such as the gynecological systems, such as diabetes and other endocrine things. And we are getting evidence of such bidirectional links. I would say that we have very strong literature support in at least a few of these, such as diabetes, which we have a lot of evidence, and the relationship which has been established is actually a one-word answer. What is causing this bidirectional relationship? The one-word answer is inflammation,
right,
or inflammatory mediators, which flow via bloodstream from our periodontal pockets to faraway organs and cause the damage there. So this, as a periodontist, as a dentist, it is my fervent appeal to all your listeners who I know mostly would be a dentist,
Sure.
to learn to control this inflammation which is there in our gingival or periodontal tissues. And once you have obliterated this inflammation, you are surely going to have a healthy body also.
Right. So there was a lecture of yours, and the topic was Periodontist, a full body healer.
Yes.
Could you
Very
please
true.
share some glimpse of that lecture,
Yes.
if you can?
Yes. Because, this concept is not new. This concept, in fact, has its origin some 150 years ago, when for the first time Miller in 1891 and then Hunter in 1900s said that uh, oral microorganisms or teeth in essentially are basically responsible for a lot of problems in the body. But that concept could not take over at that point of time, because instead of removing inflammation, the dentists of that era were removing teeth.
Oh.
So what was happening is the patient was losing teeth right, left and center. But during 90s and early this century, we have understood that we do not need to fight with the teeth, we need to fight with the inflammation. So control the inflammation and your problems are controlled. And this, very interestingly, even during this COVID pandemic, we could see some research papers published which stated that, the episodes were more serious in nature in the patients who were having a lot of periodontitis. So in a way, if we are able to control the inflammation, that is, we keep the periodontium healthy and happy, we are going to keep our body healthy and happy. So that was that.
Right, sir. Thank you so much, sir. मतलब बातें आपके साथ चलती ही रहेगी, ऐसा लगता है अभी.
Thank you, Dr. Karthik, and I remain at your service for future, episodes. This is a great work you are doing. It's a great awareness job which you are doing, and carry on with a lot more of this enthusiasm. We need more people like you in our field. And before I leave, I wish to thank your team also, because they so wonderfully, conducted the entire episode. And I look forward to be with you again,
Sure.
sooner than later.